Hello everybody, and welcome to the Wednesday edition of Video Clips. And I thought what I would do today is tell you what I'm hearing from healthcare workers around the country, because I think they have a great pulse on what's going on. So here goes. I'm an ICU nurse in a 50-bed rural hospital in Vail, Colorado. Although the hospital prepared for a surge, we did not see it. I'm very worried about the fallout from all of this, particularly in our isolated community that struggles with mental health and addiction at baseline. I'll talk more about that on Friday, but this is a very, very big concern that I have here in Ohio. Here's another one. I work as a surgery recovery nurse in a hospital in the Sacramento area. We were terrified when weeks ago our manager informed us that we were on the same trajectory as Italy based on the skewed models that I've been talking about. He stated we would have ICU patients spilling out into other areas of the hospital, and we all received training on managing patients on ventilators. Nurses and other healthcare workers have been crying, and we've all socially distanced ourselves from our family members. So far, we haven't had this surge that was expected. Today, we have 5 COVID patients in our hospital and only 1 in ICU, a 77-year-old with multiple health issues. A friend who works at another hospital states they have 2 patients, none in ICU. This has been the trend, give or take a few, for the past several weeks. Since our hospital census is so low, nurses are not getting the work hours they need to support themselves. I've turned off mainstream media since it creates anxiety and fear. I'm trying to find credible sources of information online to get accurate data. Your videos have been insightful, and I want to thank you from the bottom of my heart for getting the word out. I'm terrified that this might be a vaccine agenda or worse. As I mentioned yesterday, stay tuned for Thursday's video clips. I will share some truly frightening information with you. But not only is the unemployment rate ridiculously high, I think we have 25 million people in the United States on unemployment. We have healthcare workers who should be fully employed. There are plenty of people who need surgeries and need healthcare, but they can't get it right now. So we're laying off and furloughing healthcare workers. Here's an email from England. I work as a healthcare assistant at a hospital in England. In the last 2 weeks, wards were getting shut down and permanent staff have been deployed to other slightly busier wards. The so-called busy wards or COVID wards are not that busy at all. And the situation is getting worse to a point where staff, including nurses and carers, are loitering around the wards because there's nothing to do. Bank or temporary healthcare assistants since the start of this week have found themselves without work. They are not required, and the majority of them now are sitting at home without work. It's a very worrying time. Some colleagues I've spoken to have told me they're busy looking for work in other places because they don't know how long the situation will be like this. It's the same in other hospitals and other healthcare professionals around the country, again from UK. Governor Cuomo of New York City informed President Trump that the city no longer needed the U.S. Navy hospital ship, which has been docked in New York since March 30th. The total number of patients ever placed on the boat, 179. The ship has 1,000 beds. Cuomo thought it was better to take patients to the Javits Center, apparently suffering from the same disease as our health department director here in Ohio, who thinks that convention centers are better than opening up closed hospitals to take care of patients. And you just have to love the optics. Available hospital rooms for all the sick people is not as sexy as temporary hospitals set up in convention centers. Tents and parking lots are even better. And if that doesn't do the job, you can just borrow some footage from a place that was really overwhelmed like Italy and claim it as your own. Yes, this is happening. For example, CBS News used horrifying footage of an overburdened hospital ward in Italy when reporting on COVID-19 in New York City. When confronted with it, the response was, it was an editing mistake. We took immediate steps to remove it from all platforms and shows. Well, the damage was already done. More people panicked. Oh my gosh, it's just like Italy here in New York. And we're going to have to put people in convention centers. There's not a single patient in a convention center here in Ohio, but they're all configured for it because our health director thinks that that is a great idea. Reopening closed hospitals, bad, that are fully equipped. It's much better to show all those beds in the convention center. And if you do it regularly, keep people in a constant state of panic. And isn't that what this is all about? All right, I watched your video clip episode today about the large number of healthcare workers being furloughed, laid off, or forced to take pay cuts. I live in Portland, Oregon, and our state has had a relatively low number of serious COVID cases with no significant increase in the use of hospital and medical resources. In fact, Portland's largest healthcare employer, Oregon Health Sciences University lost $24 million in the month of March, and the losses in April are expected to reach $70 million, according to an article in the Oregonian from today. They also state the surge of cases never came close to early predictions and now seems to be trending downward. In the Portland area, my colleagues and I are being forced to work part-time or take voluntary temporary leave of absence without pay compensation due to such low volumes of patient visits right now. My former colleagues working in a large teaching hospital in Charlotte, North Carolina, have been in the same situation, forced to cut their hours by 50% or more. Rochester, Minnesota-based Mayo Clinic will furlough or cut the hours of about 30,000 staff members to offset $3 billion in losses due to the COVID episode. The furloughs or reduced hours affect about 42% of Mayo Clinic's people. Physicians will get a 10% wage reduction. Senior managers will receive pay cuts of 15%, and top executives will take a 20% reduction. So this is incredible. $3 billion in losses for Mayo Clinic. This is great public health policy. The geniuses behind this definitely should win the Nobel Prize. That really will make my head hurt if these morons get nominated for a Nobel Prize. Kaleida Health in Buffalo, New York, which has said it's losing up to $30 million a month as a result of COVID-19 panic, is offering voluntary furloughs. They have unionized workers, so they've got 8,000 people they're begging to take time off without pay. We'll see how many of them are willing to do that. And the last one I want to talk about is, you can look this up online, a respiratory therapist who calls himself respiratory therapist Stand Up 911. He's reporting his firsthand experience working in a hospital that's treating COVID patients. And here's what he has to say. Ventilators. There's no shortage. The video was filmed, in fact, in front of a large room containing many ventilators that are all draped in plastic. They're using fewer than usual, not more, and the reason is there are no elective surgeries taking place right now. And as you'll see in the Friday segment, you won't believe what's elective. Cancer surgery, elective. Amazing. There are many non-invasive means of offering breathing assistance, CPAP is an example, but staff has been told not to use any of these, wait for the patient to crash, and then use the ventilators. Everything that would normally be standard operating procedure is not done. If you can only use ventilators, then in some areas you are invariably going to cause a shortage. Many companies make ventilators. Why in the heck is General Motors doing it? And who's testing these ventilators, and who's training staff how to use a ventilator produced by General Motors? In terms of the diagnostics, here's what he reports. Any patient arriving at the hospital with respiratory issue is labeled COVID. If you have lung cancer or pancreatitis or anything that could make breathing difficult, that might make a patient require breathing assistance, now labeled a COVID patient. In his hospital, there's only one lady who can test, so many patients die before they're tested, and even if they arrive with lung cancer, they're labeled as a COVID death. And of course, the Centers for Disease Control issued instructions about how to fraudulently put that on the death certificates. The tests used are not testing for a virus, which was confirmed on CBS News, by the way. I looked this up. Not one test tests for the virus. They're testing for an RNA sequence that is a reaction to the virus, which can come from cancer, radiation, and many other things. The sample is put into a PCR, so if there's even a shred from a damaged cell, it shows positive. So we're ginning up the cases, particularly in symptomatic people, and we're lying about the death rate. There's some information about that. One very brave health director in Pennsylvania, who has both a brain and a spine, two things that are incredibly lacking today, actually decided to defy the CDC's order and use real deaths. Think about that, in the interest of transparency. Unheard of. Why would you want to tell the truth about this when you can keep people in a state of panic and fear and get them to do what you want? Stay home, lose your jobs, lose your businesses, rely on the government. Wait for us to tell you what to do next. Well, like I said, tomorrow's video clip will curl your hair. He questions the entire premise, back to our respiratory guy, showing the numbers like a football game, he says, is done every day to scare you. He's never seen bodies loaded into a tractor trailer, and he doesn't believe it. Based on what I told you about the footage in New York, I'm starting to not believe that either. He also says that this is just not as contagious as people say it is, because if it were, there would be more healthcare workers who would be sick, and in most places they're not. He's not convinced that it's a virus. He said it might be something else, but if it is a virus, it's going to go away. That is the usual trajectory. And one thing he said that was very interesting, he said, doctors believe this ridiculousness as much as the patients. They have done nothing to look into it. Now, there are some exceptions. You probably have seen some of the videos out there produced by doctors who are asking questions and are saying there's something terribly wrong and the numbers don't match and something is wrong. But the vast majority of doctors are just going right along with it. And somebody emailed me and said, what is wrong with doctors? I said, well, let's think about it for a minute. Pretty girls who used to be cheerleaders in high school who went to work for Purdue Pharma went out as drug reps and told doctors there was an epidemic of untreated pain in the United States and opiates weren't addictive, and look at what happened. A lot of them believed it. And you might be thinking, well, you know, the pill mills, and they were responsible for some of it, but there was widespread prescribing of opiates by physicians all over the United States, all over the world, based on really just telling them that. And so when you have a group of people, and there's many watching this who are exceptions to that rule, and please understand that you are an exception to the rule. But when you have a profession of people who are so easily convinced of something so nonsensical as what was told about pain and opiates, I guess it was pretty easy to gin them up about all this and get them on board. I know that the non-thinking person who's in charge of the health department here actually is the governor of the state. She makes all the decisions about what's going on here. That person was easily convinced and was unable to even offer a data-based explanation of the differences in models one day when she promised to do that. It made the national news, by the way. Dr. Amy Acton's charts with no numbers, brilliant. One thing you'd love to be known for is incompetent government employees in your state, right? So anyway, this is what doctors and nurses and healthcare professionals are reporting all around the country. If you happen to work in a hospital where you are overburdened, I'm not questioning that that's the case, but what I'm telling you is it's not the case in most places. And it's important that we not base our decisions for 330 million people on what's going on in 4 hospitals in a couple of major cities. All right, so that's all for today. Pass this on to anybody who you think would enjoy watching it. Remember, if you want a copy of that newsletter article, subscribe and we'll send you the back issues so that you have the complete COVID collection. And I'll be back to you tomorrow with more news.